EPA and DHA if we have alpha-linolenic acid and alpha-linoleic acid. And the body converts the alpha-linoleic acid to eicosapentaenoic acid and more slowly to DHA. And the deficiency of the linolenic acid can result in insufficient DHA production. And when you look at healthy cell membranes, they're not all EPA, DHA. They have a lot of the linolenic acid in it. And so what you, again, a reason to look at is to know how best to supplement. You don't want to supplement exclusively with EPA, DHA, or DHA alone. You really want the primary essential fat, and the product I'm using right now is this Yes products, because it's a very high quality product. And but I want to measure and know where things are going. Next. So high consumption of the omega-6 essential fat, linolenic acid, can inhibit the synthesis of docosahexaenoic acid. And therefore diets that are rich in corn, safflower oil, sunflower oil, and peanut oils that are high in linoleic acid and low in alpha-linolenic acid, the omega-3, may lead to an omega-3 fatty acid deficiency. Next. And that diets high in the alpha-linolenic acid, the omega-3, show protection against fatal ischemic heart disease and have an antiarrhythmic effect. And the largest sources come from salad dressings containing soy oil. Foods that are rich in this product include flaxseed oil, soy, canola oil, and English walnuts are also very high. So they're a great snack food, if you would. Next. And so again, I keep saying we have to come back around and to reduce and to reduce free radical formation if it's excessive, and optimize the quenching of free radicals through the use of appropriate antioxidant supplements, but by encouraging the production of superoxide dismutase and other endogenously produced antioxidant proteins. Next. And so these are the products that are useful. The glycerophosphatidylcholine, or GPC, and has been shown in very good studies to have very good benefits. It's terribly expensive, so I keep trying, well, how could we figure out a way to use it so that, control the expense? My idea is you'd load a person for about 4 to 6 weeks, and then you'd go to an every other day dose or a twice a week dose once you got them loaded as a way of controlling the cost. Next. Just to point out, at least in animal studies, there's been some very interesting value in terms of the, promoting healthy cell function. Next. And this was just in Italian literature about showing that in people who've had strokes or cerebral ischemia, if you do MRI scans of our brains, we all have little holes in them. We all have this problem. And it just shows that this helped a great deal in the recovery. Next. Phosphatidylserine is a second component of cell walls, and it has clearly been shown to improve memory function. Next. This is just a slide that attempted to show you the value of supplementing with quite a bit of the stuff, 500 milligrams a day for 3 weeks. And these special scans show healthy activity. This is before, this is after, at different slices of the brain, showing that it was quite beneficial. Next. So again, the money themes are healthy cell membrane and adequate delivery of oxygen, and then adequate extraction. So the human brain uses more oxygen and produces more energy per unit mass than any other organ of the body. And in most cases, with increasing age, cellular energy production is limited more by adequacy of oxygen delivery than any particular nutrient you take. So you could take all the nutrients and supplements in the world, but if you're not delivering enough oxygen to the tissue, or the tissue can't remove the oxygen, hence the importance of a healthy cell membrane with appropriate combinations of unsaturated fats, then all those expensive supplements aren't going to be that useful. Next. So the the arterial resting oxygen level, PaO2, declines with aging and stress. And average, these are average values in different age groups. Next. And with severe stress, like you have surgery or an accident or you're just driving yourself crazy, you can actually reduce these levels very significantly. And stresses can include any number of things from temperature extremes, noise, trauma, infections, and inactivity. Next. And so we can determine the quality and quantity of oxygen delivery and utilization using 3 tests: transcutaneous measurement of arterial oxygen levels, which is almost as good as an arterial blood gas, and the measure of venous oxygen level through a venous gas analysis, and then the cardiopulmonary stress test that we do. Next. And then you can, the transcutaneous arterial oxygen level is, measures the amount of oxygen being delivered to the tissue capillary beds. The venous oxygen level measures the amount of oxygen removed by the capillary beds. So try to get down to some precision, not that any of this can be highly precise, but where we can actually tell you, okay, these are the things we have to try to fix. Next. And oxygen, again, utilization is key to energy production. Energy production is key to healthy organ function. And oxygen utilization can be impaired because of reduced delivery of oxygen or inadequate removal or uptake by the tissue. Next. And the inadequate oxygen uptake can be due to abnormal essential fat compositions of the cell membrane, hence the importance of understanding an individual's imbalance and addressing it. Next. And the cardiopulmonary stress test looks for pulmonary disease, heart disease, and the efficiency of oxygen utilization. In addition, it can determine the need for additional diagnostic testing, whether we have to send people for even more sophisticated cardiac tests to see if they have blockage. And it provides very precise exercise parameters that ensure safety and optimal benefit. Next. And the regular exercise is very effective for people in moderate to good health. In older individuals or those with impaired health, exercise with oxygen or oxygen multi-step therapy is a way to reset both the arterial O2 level and improve tissue extraction of oxygen. So the doing of the oxygen multi-step therapy for somewhere between 2 and 3 months actually improves the situation so that you don't have to keep doing it until the levels go down again. And you might go for months or a year before that was an issue. Next. This is just the hide of an elephant. I was trying to show a picture. Next. If you don't learn to laugh at trouble, you won't have anything to laugh at when you're older. Okay. Next. Okay, that's it. I'll take any questions you have, or if you just want to get up and wander around. Okay, if you could turn the lights on.
Dr. Ross, I would just let you meet my daughter, Sandy.
Hi, Sandy.